Are there good alternatives to ACDF surgery? Yes, they are, and I am here to show you what they are. You can always do physical therapy, of course, but do a longer course of physical therapy than what your physician recommends. Usually it's between 4 to 6 weeks, but if you're seeing any improvement at all, continue with the PT because sometimes that's all you need. Another great option is to do steroid injections. Oh yeah. Steroid injections in the neck are pretty painful from what I've heard. I did not have that opportunity. I do get them in my lumbar spine and I don't think they're awful down there, but my mom got them in her neck and said that they were pretty uncomfortable, but they do give you relief for anywhere from a month out to years. I mean, sometimes you get one injection and that's it. You're good to go forever. But that is something else to consider. And I'm sure some of your physicians will bring that up. In case they don't, just ask, would a steroid injection be appropriate at this time? There's also nerve ablation. It's just like the steroid injection, only instead of injecting a steroid, they inject a medication that basically kind of kills the nerve in that area so that it stops the pain. That one I have heard can be very successful in some people for a couple of years, and so that's wonderful. One of the other treatments that you can do, of course, is ask and see if you are a candidate for spinal disc replacement. Check this out. Haha! My husband used to work for a spinal disc replacement company, so I have this. This, of course, is a lumbar disc replacement. The only difference between the lumbar and the cervical are that the cervical are much smaller, because of course the vertebrae up here are smaller and the gaps between the vertebrae are smaller. So with this, you have the option of maintaining that movement in your spine, which is really great. This is a little sticky just because it's a model here. It's a pretty model for that. But you're gonna have that movement be maintained. You get up and on your feet a lot sooner. You just wanna make sure you're a candidate for those. I, however, was not a candidate because I had too much degeneration in my spine. I have scoliosis, undifferentiated connective tissue disease, fibromyalgia, hypermobility, you name it. So they said, that's not gonna work for you. The other option is to do a stem cell treatment to repair your damaged disc. This is not something that's typically brought up by doctors because it is not covered by insurance, unfortunately. I spoke with my pain management doctor about stem cell therapy, and he said that he was actually part of a group that ran a lot of trials on stem cell therapy, and he said it worked really, really well. Most people on average were getting at least 1 to 2 years out of one treatment of stem cell therapy in their spinal discs. And he said that they only have data on 2 years out, but they had a lot of people who the stem cell treatment was still working really, really well. The only problem with this is insurance does not cover it, and it costs between $3,000 and $6,000 per disc that you have injected. So I was talking about this for my lumbar spine, but I know it's also available for your cervical spine and for other joints in your body as well. So I just wanted to make sure to throw that out there and give you an option, because if you have an option and you can avoid surgery at all costs, that is a really good one if you can afford it. In my case, I was not a candidate because mine was emergency surgery, and by the time you're at the emergency surgery point, there's nothing else you can do other than do exactly what the surgeon tells you is gonna need to happen for this. There you have it. Those are the alternatives to fusion that you can look into if you are considering ACDF surgery. Just remember, I'm just throwing some options out there. I am not a doctor. You need to talk to your doctor and then maybe get a second opinion if you're not on board with what one physician says, so that you can make the right choice for your body. I'm Amy Giaquinto. I am Mama Fix It. Please let me know about your ACDF journey experiences in the comments below. I read the comments and I do respond to every comment. So just give me a couple of days. I will get back with you. Thank you so much. If you'd like some more information, you can check out my website at www.amygiaquinto.com. I will leave it linked down in the description below. Have a great day. Bye. This is so cool.
Hello. How are you? I am good.
really good because my back doesn't hurt anymore. Oops, I'm stuck. Because, yeah, this gets a little stuck. Arthritis.